Osman. I always forget that I don't have to do an elaborate introduction because our colleagues take care of it for me, but maybe I'll just do a fun fact not related to my academic journey. I'm a big Lakers fan, and so I'm excited for the season to start up in a few days here on Saturday. I want to thank all of the sponsors who came together to put this event together. I remember I visited campus last year, and I was just super excited to meet all the faculty here and all the great work that's being done with respect to environmental justice. So an honor and a pleasure to be here. As Iris mentioned, my work really centers at the intersection of equity, environmental justice, and civil infrastructure systems, and thinking creatively about how we can combine the social aspects of these things with the engineered systems and the technical aspects. And so for today's presentation, I'll be discussing water and sanitation justice in hopes to sort of frame the current landscape for water infrastructure systems in disadvantaged communities and to discuss a path forward. I think that's the most important part. Actually, not the most important part, but it's important that we think about a path forward because one thing. When I was signing up to do the seminar, Iris had also asked me to talk a little bit about my path. And I wanted to talk a little bit about that with you all today, since you're all young students. And I just love seeing all the fresh faces here. So growing up, I really just wanted to be the world's greatest boss. I'm kidding. That's what I saw over there, Dunder Mifflin Paper Company. No, so I did my undergraduate degree. I really want to talk about just the different pathways that are out there for students who are studying civil and environmental. And here it's cool. They've added even the word sustainable engineering, which I'm appreciative of. I got my undergraduate degree at the University of Portland, which I think is also in the West Coast Conference, sort of a competitor of Santa Clara's. And during my undergraduate degree, I was in civil and environmental engineering, and I was really interested in doing project management, and I didn't get that in my undergraduate degree. And so I decided to pursue a graduate degree at the University of Texas at Austin, really focused on infrastructure management. How do we manage these infrastructure systems that we're all using every day? Are the decisions made that certain pipe is put somewhere, or that somebody's water turns on and somebody else's doesn't? I was really curious about those decisions, and so I went and pursued a master's. And when I started my master's, I had never heard of what research was. I was like, what's research? I don't want to do that. I want to get my professional degree, start working. At the time, I was interning for the Bureau of Environmental Services in Portland, looking at wastewater operations and asset management. And when I got to UT, my advisor, just my academic advisor, when we were picking courses, said she had this huge data set. It was post-Flint. And she had a large data set of data from cities around. I dove into that data. I started to realize, and I started diving into more literature. I realized that I'm really enjoying what I was doing. And that's where my sort of passion for research came in. And I saw the impact that research could have, but also this huge gap in terms of not understanding what water equity or water justice was, which leads to some of these decisions being made in these communities that impact people negatively, particularly disadvantaged communities. And so that's my path. Obviously, I stayed 6 years. I overstayed my welcome. I remember my laptop was breaking, and I asked my advisor, can you buy me a new laptop? And she said, no, that means you need to leave. That's just a little bit about my background, but I'm more than happy to answer questions during the Q&A and have discussions about just exploring different pathways as civil engineers for all of you students who are here. And so to get started today, I wanted to discuss sustainability. There's several different models of sustainability developed and distributed across literature. However, I wanted to focus on a common one, thinking about this triple bottom line, looking at the economic, social, and environmental aspects of sustainability. And where we know that decisions made in each one of these sectors really influences sustainability outcomes as a whole. And so I'm going to zoom into each one. The first one is the economic sustainability, looking at, profit variables, thinking about the bottom line and cash flow and how we make our businesses more sustainable, and how do we create economic good through sustainability for society. The other one is the environmental. Thinking about the planet as a whole, the ecosystem services of the planet, environmental variables relating to natural resources, water, air quality, energy conservation, and land use. And with the first two, in terms of economic and environmental sustainability, there's a lot of research, a lot of data, and particularly in the engineering field, there's been a lot of emphasis in that area. But I'm purposely presenting social sustainability last. It's the evaluation of sustainability goals and impacts on people, which is not as widely recognized, right? We don't talk about this one too often, at least not in the circles that I'm in. And these social variables, they deal with community, education, equity, social resources, health, well-being, and quality of life. And so I often struggle with why we don't talk about this one as often, because sustainability cannot be achieved without the factoring in all three components together in a representative manner. And so I just wanted to quote before I jump into my presentation, that was a little bit of context in centering us today, that when we're thinking about systems thinking, there's this quote here from environmental scientist Donna Meadows: a shift in mindset, the highest point of leverage to intervene in any system is mindset. And I think that's profound. A shift in mindset, I think, is absolutely necessary to address the topics that I'm discussing today. And so jumping in, I always love to start my presentation with this slide. When we think about all the different ways in which we interact with our water systems, we're reminded that it's not only a technical system, it's a socio-technical system, right? And water infrastructure particularly is a socio-technical system, meaning that the design of these systems, the design, the operations, the maintenance, the planning, really should consider human, social, and organizational factors in addition to the technical factors. So we can't just focus on one aspect. And so in the next few slides, I'll cover a couple of definitions, but I'm curious, just from the crowd, is there one thing up here that you noticed that you didn't really think about? Let's move forward. And so these definitions I'm going to cover, the first one is inequality. And inequality means to have unequal access to opportunities, or that there exist disparities in the distribution of opportunities. And so here in this picture, we see that someone has access to the fruit tree. And even though another person exists there, quality, which is defined as evenly distributed case, goods and services. And the challenge with equality is that it does not guarantee access to everyone. That is because it is not considered the differing needs and abilities of people. And so here we see that even though both people have a ladder, one person still can't access as many apples as the other. Next, we have equity. And equity addresses inequalities by providing custom tools tailored to each person's situation, and by considering the different needs and abilities access is achieved. And then finally, we have justice, which is focused on fixing the entire system to offer access to both tools and opportunities. And the biggest difference between equity and justice is that justice is focused on correcting the system over time. And so it's not a one-time solution. Justice isn't linear either. It's going to take a lot of time to achieve justice, but a just system really breeds equitable access in the long term, because those factors that originally made them inequitable or unjust are removed or rectified. And so just a couple other terms I'll be using in my presentation and sort of setting the stage for them is human rights and civil rights. Human rights are defined as the rights that are universal to any human being. And some human rights become civil rights when governments put those rights into laws. Civil rights, on the other hand, are determined by the laws or the constitutions of an individual country, and these can vary from state to state or nation to nation. However, universal amongst both of them, both human rights and civil rights, is to protect against discrimination, injustice, and inequality. And so looking at water and sanitation justice, I want to frame my discussion today in three categories when thinking about these issues. The first one is, where are we, right? Where are we today? How are we doing in regards to this topic? The second one is looking at how we got here. What combination of decisions had to happen to create an unjust system? And then finally, I'll be discussing a path forward. Water justice, water and sanitation justice is achievable. And the fact that I'm presenting here today is an indication that we're interested in solutions. And so now that we have our definitions, let's jump into the main topics. Where are we? And so I would like to just have a couple of news articles, either when I'm teaching class or giving a presentation, just to show that these are not problems that are, 10 years ago or 5 years into the future. They're problems we're dealing with now. And so this is a community that's majority Black, and they're dealing with a broken sewer system, and they fear a lack of oversight. And I'll grab a quote from that. I don't know if many of you have heard of Catherine Flowers and her book, Waste, America's Dirty Secret. And the project I'll be presenting at the end of the presentation is specifically in partnership with Lowndes County and Catherine Flowers. But, the climate change raises the risk from failing sewage systems. And so Catherine Flowers has been on the forefront of addressing those things. And then this is Mount Vernon, New York, and I just grabbed a screenshot from YouTube. We have residents are worried about their health and desperately begging. We live in the United States of America. Should we be begging for our infrastructure to work? They're having sewer issues and sewer overflow issues there. And so the inequitable distribution of infrastructure burden exists. And so this is a quote from the first article, resident after resident, mostly elderly and Black, shared stories of trying to repeatedly get local and state officials to repair broken sewer system pumps, check sewer lines, and clear overgrown drainage canals. And the quote under there says, no community should have to go without clean drinking water, functional waste infrastructure. True justice and true fairness means a safe home, clean streets, clean water, and clean air for these communities. And so that's on the sanitation side of things. And then on the water side of things, I know we've all remember just roughly a year ago, the Jackson water crisis. And, there's a lot of factors that played into that water system failing. And a city of 88% African-American people not having access to water. But the one that I wanted to focus on was this idea that it was foreseeable, that residents had been complaining about the water for a while, and that it wasn't just something that happened overnight. It wasn't, an unseeable or unforeseeable, as they stated in the article. So here it says public health crisis decades in the making was wholly foreseeable by defendant actions, and Jackson residents were left in an untenable position without access to clean, safe water in 2022 in a major United States city. And so there's a difference between having a plan and not having mutual priority over its funding. And so just going further into where we are today with regards to water and sanitation justice. And so this map here was put together by NRDC. They looked at water violations and cross-listed it with racial vulnerability from June 2016 to June 2019. And they published a report. And it wasn't just the physical infrastructure components that are failing in communities of color, but also the quality of water received by such communities. And this map is showing this intersection of water violations overlaid with race, ethnic, and language vulnerability. And vulnerability, as they defined it, is the degree to which a population, individual, or organization is unable to anticipate, cope with, resist, and recover from the impacts of disasters. In this essence, what was found in this study was that over 5,000 community water systems had a combined 23,000 health-based violations while serving approximately 45 million people. And the relationship between racial, ethnic, and language vulnerability and the persistence of violations was the strongest of all the relationships that they found. And they studied compliance, enforcement, and other sociodemographic characteristics. And so when we look specifically at health-based violations, things that can impact you, send you to the ER, make it challenging for your children to live healthy lives, there's a similar trend in that 406 counties had the highest rate of health-based drinking water violations and the highest rate of racial, ethnic, and language vulnerability. And the potential health effects that they were looking at are things like cancer, developmental effects, and nervous system effects. And to me, this was the most compelling of the three charts that I showed today, which is the length of compliance, the length that these systems are failing for, or how long they're failing for. When examining slow and inadequate enforcement actions, 437 counties across the country had the longest average length of time out of compliance per system. And when overlaid with the highest racial, ethnic, and language vulnerability, there was a strong correlation. And so the percentage of systems with violations for 12 consecutive quarters, a quarter is 3 months, so we're looking about 3 years, was 40% higher in counties with these similar demographics, as I've been mentioning. And so if we're zooming in a little bit into California's water justice challenge, I think at least most of us are aware of the Central Valley and the challenges that they have with water in Central Valley. But, when we talk about the Central Valley, we don't talk about who lives there. And the majority of people in the Central Valley are people of color who are most likely to experience these water quality violations. Water systems are in disadvantaged communities, and rural, tribal, and urban communities are the most at risk. And so what are the required systems investments? The American Water Works Association, to sort of try and solve these issues, estimates that we need $1 trillion over the next 25 years to solve water system problems. And this could triple your water bills. Water bills are already expensive as they are. They're unaffordable. And imagine those being tripled just to cover the cost of maintaining and receiving adequate drinking water. And these estimates don't include the cost of compliance with Clean Water Act and Safe Drinking Water Act. This is just to maintain baseline performance. And in addition, the estimates that the AWWA put together doesn't include the effects of climate change, which will result in more severe storms in the East and Midwest and droughts in the South and West, which will place additional strain on U.S. water systems. And so it's important to consider those. And so when we're looking at the water equity literature, we see that, it's picked up steam here in the last, I want to say 20 years. But before that, there wasn't really this conversation of how do we incorporate equity into our water systems. And just for reference, the Clean Water Act and the Safe Drinking Water Act, those were put into place in the 70s and 80s. And so you would think that at the inception of those land-breaking laws, we would be considering equity. But at the time we weren't. And I'll talk a little bit about why that was. This is just more, jumping in a little deeper on the existing literature and what it looks like. And I think we can zoom past this. I really wanted to show with this chart is that there's not really a single consistent definition, and it's challenging because water systems are so spread out. We have over 50,000 across the U.S., and we really need to localize definitions and not think about them broadly, because then they can become too vague. And so this does increase the difficulty of deriving consistent scales and metrics for measuring water equity, but that doesn't mean we shouldn't have them and we shouldn't work on them. And so I just wanted to switch gears a little bit. There's a lot of history of where we are today in 2023. So how did we get here? And in the next slides, I wanted to talk a little bit about some of the key contributions to where we got today in terms of water injustice in the U.S. and water and sanitation injustice. But I do want to preface by saying these are not all of the reasons. I want to make sure I put that out there. The problem is more nuanced than I can do in a 45-minute presentation, but I've tried to capture some of the major ones. And so if we take a historical approach, we find that the investments made during the days of the Safe Drinking Water Act and Clean Water Act were not too far removed from the civil rights era in our nation's history. And in this regard, multiple studies have shown that as water systems were constructed throughout the U.S., Black neighborhoods were often delayed in receiving these services. And as residential segregation really increased throughout the 20th century, Black access to municipal services like water and sewer actually decreased. And so if we look at the period of about 10 to 15 years in the 1970s and 80s, the federal government actually provided a substantial amount of subsidized funding, often in the form of grants to water and wastewater utilities across the country. However, since the mid-80s, the federal government has actually reduced subsidized funding and actually has switched from providing mostly grants to providing mostly subsidized loans to the state revolving funds. And while federal funding programs have been maintained at relatively steady rates since then, we see that the real purchasing power of these have diminished over time if you account for inflation. And so the challenge here is that the communities of color that did not originally benefit from these investments subsequently now are not benefiting either, because the disinvestments compounded over time, which results in the failures we see today and their disproportionate impacts on these communities. And I just wanted to show that if you were trying to do the math there, it's about a 70% decrease in federal funding for water systems over the last 15 to 20 years. And then another issue when we talk about, how did we get here is this privatization of water systems. And policymakers often advocate for treating water as an economic good, although in California, there is a path to recognize it as a human right, which I'll talk about a little later. But this hasn't come to fruition yet. And policy measures such as privatizing water and wastewater services, granting concessions to distribution networks and implementing full cost recovery in water systems we're supposed to actually improve water services, right? Privatizing is supposed to make things more efficient. It's supposed to make it better. But several studies have actually shown that privatizing public utilities has often failed to benefit the water users. And rather, rates are hiked, investments in infrastructure have lagged behind. The quality of service provision did not improve in the environment. I want to say that this is not for all private systems, but these studies have captured that a good amount of them have been operating in this way. The last thing I wanted to mention is this idea of agency in your water system. When it's a public water system or public sanitation system, the public actually has an agency in deciding what happens with that system through measures and votes. However, when it's privatized, you don't. You just pay your bill and either get access or don't. And then COVID-19 actually was a profound across every sector in the United States. I just wanted to give a little bit of background on how it had exposed some of the continued neglect of our water infrastructure and magnified a lot of longstanding social and environmental stressors, as well as economic inequities here in the U.S. Water infrastructure's role and importance to health, hygiene, safety had never been more obvious, right? You know, everybody had to wash their hands. You were being demanded to wash your hands. And several states instituted mandatory water shutoff moratoria, preventing people from losing access to water because they deemed it so important. And so what this chart shows is when states did not, or voluntarily had moratoria status, or whether it was required. It shows the active, expired, and voluntary. This chart is a little old. As of right now, I don't think any state has water shutoff moratoria still in place. There's a lot of places in the U.S., like in Michigan, where they're fighting to reinstate water shutoff moratoria because the people in Detroit are dealing with large-scale water shutoffs due to past bills. And so I just wanted to say that, we realized that water is so important because during the pandemic, we decided, no one could have their water shut off. And then once the pandemic ended, we decided actually maybe we can start shutting them off again. And so the path forward, we're not in an ideal situation with our water infrastructure systems and services today, and we haven't been in the past. However, today's a new day, and we must chart a new path forward. And so I wanted to spend a little bit of time discussing how to turn some tragedy into triumph. This is all not negative, I promise. And a lot of this happens through communities, partnerships. But the framework I try to use when thinking about the path forward is this framework here developed by the RDC together, which is focused on identify, engage, and support. The first step is really identifying disproportionately impacted communities and identifying an identification of underserved, overburdened, disproportionately affected communities is important because right now, the way our structures are set up, we require them to self-identify. And in communities where there's no capacity, it's really hard to self-identify. And if you feel like you don't have a voice or agency, it becomes even more challenging. So engage as active partners in setting agendas and prioritizing the effects, agendas and the priorities that affect their lives, and then support. The goal should be to use knowledge and tools for prevention, not reaction. And there's a lot of momentum right now in administration and Justice 40. And I just wanted to say here that, definitions are important. In Justice 40, it says that, the first time ever in our nation's history, the federal government has made it a goal that 40% of the overall benefits of certain federal investments flows to disadvantaged communities that are marginalized, underserved, and overburdened by pollution. And here I say definitions are important because as soon as people found out there's this pot of money, the definitions of benefit, started to get construed, and the definition of what disadvantage means started to get construed depending on where you live. And so it's important that we pay attention to how we're defining these things so that we are still capturing the communities that we are thinking of. And then just a little bit more on the CEJST and how it's sort of lacking in regards to water and wastewater metrics. And this, I think, is a cool area of research to explore. How can we incorporate more of what disadvantage means with regards to water and wastewater? As of right now, the CEJST just defines it as the density of leaking underground storage tank within 1,500 feet of a census tract, or the model toxic wastewater discharge in streams within 500 meters. It doesn't discuss, water affordability, access to water, having premise plumbing, not having premise plumbing, having lead in your water. All of these things are not considered as part of the CEJST. So. And so I wanted to discuss two case studies today. One is based in California, looking at water system consolidations as a method for managing water infrastructure systems and creating more just frameworks and structures. And then the other one is rethinking our sanitation systems, particularly in rural communities. So let me jump in. So I think just for context, in I think it was 2012, last year was the 10-year anniversary. California established the law that water is a human right in the state. And just to set some context here, California is the most populous state in the United States with 39 million people. There's a large agricultural production, over $50 billion annually of agricultural production happens in California. And so there's also diverse ecosystems with climate trends of multiple very dry years followed by a couple wet years. And so we get excited and distressed in each one of those. As we saw last year, there's a lot of news reports saying, oh, we've got tons of water in California. There's no drought. But that's not the reality, right? So in 2012, California explicitly established water as a human right and has taken a variety of actions to ensure that for all residents. And one way to advance this is through consolidations. Consolidations is a failing drinking water systems, and the State Water Resources Control Board has the authority to mandate consolidations in disadvantaged communities that consistently fail to provide adequate water services. In 2017, the state began releasing data on completed consolidations, including system characteristics and violations prior to consolidations. And these are some of the data that we'll use in our analysis that I'll be discussing. In 2019, the SAFER program, the Safe and Affordable Funding for Equity and Resilience, which provides technical, financial, and administrative resources for drinking water systems, including support for consolidations. The SAFER program also oversees the annual drinking water needs assessment that happens in the state, which we've also used for this analysis. And so what is a consolidation? We have two systems that are geographically close to each other, but have distinct infrastructure and management systems. And so these can be consolidated through two pathways. The first one is managerial consolidation. And under managerial consolidation, the physical infrastructure remains separate and is unchanged, but the smaller community's utility or management structure is dissolved, right? The larger system's utility now oversees operations of both infrastructure systems. In a physical consolidation, the managerial services are extended to be the smaller systems, and there is a change in infrastructure. Larger system is now extending a pipe to the smaller system, and they are sort of changing our systems or improving it by adding the resources that the larger water system has. And so I just wanted to give an example of where this was successful here in California. In this case study, we'll visit the Central Valley of California and specifically the city of East Porterville. During 2017 droughts in California, the wells in East Porterville went completely dry, meaning there was no water at all coming out of these wells. And so this community is 70% Hispanic, 91% poorer than the rest of California, and has a history of air pollution, poor water quality, low birth weight, and issues of access to healthcare. And at one point during the drought, the state was actually paying $650,000 a month just for emergency water, temporary holding tanks, and deliveries. And the total cost of East Porterville's drought rescue, putting in all of these temporary measures, is estimated to be over $40 million. And they didn't really have a choice because this community was completely without water. So what I wanted to show with this is that the longer we delay maintenance, and I think we teach this in our civil engineering courses, when you look at the curve of when you have the most influence on cost, it's usually early on in a project, and prevention is often a lot cheaper than reaction. And so a quote here I just wanted to put out, and this is directly from a resident in East Porterville, is: a lot of people in my community don't want to speak and let people know they are suffering. When you come home from work after 10 hours and there's not water, it's very hard. A common theme in vulnerable communities, in addition to language barriers, is a lack of trust of public officials. And I think this is where partnerships can be critical actors in creating change for these communities, and these include academic and industry partnerships. And so in California, the Community Water Center is a great organization. They act as a catalyst for community-driven water solutions through organizing, education, and advocacy in California. And so through their advocacy for East Porterville, the state actually responded with a $35 million investment to help consolidate the water systems in East Porterville with the larger city, which was Porterville. I'm new to California. I'm originally from Portland. There's a lot of these East and then the regular city. I work in Palo Alto, and then there's East Palo Alto, which I'm doing a couple studies on drinking water quality there, which is also a smaller city. And I think that has to do with a lot of historical segregation, but that's for another topic. However, these resulted in new wells and home hookups through the extension from Porterville, and approximately 1,800 homes were being connected to a centralized system separate from their well. So now they were no longer relying on the wells or private wells. They were relying on the centralized system. And this anecdote really captures that lasting impact that drought and drying up of wells had on the community. This resident, Garcia, last name Garcia, says, "We never knew our well was something to worry about. And in the beginning, it was very hard. You had to find water, get it for your house. I worked such long days. I have diabetes. Now I'm hooked up to the city of Porterville, but I still save water all the time. And so although they are now connected to a centralized system, the fear of losing water at any moment still looms there. And so oftentimes when we implement solutions in communities, we expect them to, all of a sudden turn around and feel like everything is solved. But we have to remember that these traumatic events often cause lasting scars. So this is what I mentioned in my first few slides when I talked about the definition of justice. Justice is when systems prove to be equitable over the long term. So doing something today does not mean that it's equitable over the long term. We need to continue to support these communities. And so just jumping into the consolidations data for California, what's been done so far, there's a decent sized database of 200 consolidations with many systems receiving more than one system through multiple consolidations over time. And consolidated systems are typically very small with a median population of about 100 residents. As I mentioned, the United States has over 50,000 water systems, and a lot of those are really small. And I think consolidations is a good solution for some of them if done right. And so based on the list of violations prior to consolidation, we can examine the factors that motivate these mergers. And there's a broad range of reasons a system may be consolidated, but we'll focus on the most common. A lot of them reported no drinking water violations prior to consolidations, and most of them were motivated by water quality concerns like nitrate and arsenic. And a few folks actually mentioned being afraid of droughts and wildfires. The wildfire piece is, if there is a fire, water to put it out. It's one that we don't often think about. We think about drinking water, but you actually do need to be able to put fires out, usually with water. And if your well is not, if your system is not adequately able to do that, then you're harming an entire. Water quality. Some of the other drivers for consolidation include efficiency gains, meeting compliance, disaster response, as I mentioned during fire. And this idea that, we want to advance the human right to water. The state has the power to mandate water systems, but what we've seen through the data is that actually more of these systems are not going through a mandated process, but a voluntary process, where larger water systems are opening their doors to smaller water systems to consolidate, and there's an agreement between the two to do that. And so then I wanted to go through a couple of charts looking at the annual drinking water needs assessment to assess whether consolidations are really meeting their intended targets. And we used this data, and we looked at over 100,000 residents and all of K through 12 schools and their water systems. This excludes large systems and other types of systems, which is a shortcoming of this methodology. But each system examined is based on 4 technical criteria, looking at quality, accessibility, affordability, and then the TMF capacities, technical, managerial, and financial capacities, with multiple metrics within each of them. And so when we look at this graph, it shows which systems face high risk in different technical categories, and it examines the trends between risk types and the system's role in consolidation. And what I wanted to show with this is that When we look at the gray systems, they have not been consolidated, nor have they received the system in consolidation. They generally perform well, but for those that face some high risk, they're challenged by water access. So their main concern is water access. And this may be due to the prevalence of drought in California and the competition over water resources across the state. And then systems that have been consolidated mostly face water quality risk. The second most common are TMF, so not having enough certified operators or financial resources within the community to actually operate their water system. And so by consolidating, they were solving that problem. And then systems that have received the consolidation generally do not experience high risks. They're usually larger water systems. The highest occurrence of risk is in the category of water accessibility. Is the one thing that they're mostly worried about. But even then, it's not extremely significant. And so we also looked at the type of systems that have been consolidated to see if that has any effect on their outcome. And what we see here is that community water systems, they have the same population year round, and they're mostly drinking water systems. We looked at transient non-community systems, so no consistent population, things like campgrounds. Then non-transient, non-community, which have some of the same populations all year round, for example, schools. And what we found is that the community water systems that have been consolidated seem to face the lowest overall risk post-consolidation. And then non-transient, non-community systems have the highest prevalence of some degree of risk post-consolidation. And this is noteworthy because some of the most vulnerable populations, and we want to make sure that we're decreasing the risk post-consolidation. And so that's what I wanted to cover in terms of water. That is an ongoing project. We're doing more examinations to see if consolidations is truly a equitable path forward for water systems. Right now, it is deeming to be, but we also want to look at things like, has affordability changed for these communities that have been consolidated? Is the cost matching the output, and et cetera. And so now jumping into rethinking sanitation systems. There's a high prevalence of septic use by demographics. The systems I'm focused on is in rural communities, and we'll be focusing on septic systems for this presentation. And some of the demographics for septic system users across the U.S., some of the most common things are non-Hispanic white households or rural white households. When we look at income of people who are still on septic tanks, you've got about 100 to 150% of the federal poverty level. When you look at education, it's a lot of high level the highest level received less than high school. And then when you look at when a lot of these septic systems were put into place, you got a lot of houses that were built in the 1980s to 1999. And there's a lot of mobile homes. If you've read Catherine's book, as sounds like a few of you have, what they're dealing with in Alabama is a lot of mobile homes. And then the regions which have the most prevalent septic systems are in the non-metropolitans, South and Northeast. And so the risk of septic systems, about 30% of septic systems in this study that they did, they found about 30% fail. And the risk there is that there's a high operation and maintenance cost. And because you're on a septic system, that high operations and maintenance cost relies on you as the property owner versus the city or a county or a utility managing that for you. And then you have leakage. When the flood occurs, it comes into your septic tank and causes leakage of bad water into your yard, or sometimes even backs up into your home, which is a large challenge. And then there's a lack of regulation and testing in most places, which is they found in the study. And so the type of assistance needed in communities that are dealing with septic system challenges are financial, technical, and educational. And I'll talk a little bit about that through a case study we did in lab. I wanted to show what happens when septic systems fail and what communities often resort to when that happens. Here what we have is two homes. These are pictures that I took on a visit in July. And on the left side, you have this pond. And what they're doing is straight piping, meaning that they're taking a pipe directly from their toilet, their washer, their kitchen sink, and they're putting it directly into their backyard. And you can imagine for all of us who may have grown up with a backyard or played with friends who had a backyard, when we were back there playing, we weren't thinking about whether or not we were going to get sick from it, right? At least not from the water in the backyard or the grass in the backyard. In this community, Lowndes County, Alabama, the issue that they have is that a lot of their backyards are now contaminated with sewage and wastewater. because of straight piping. And so the communities there don't have the capacity as it is right now to really deal with all of the septic failures. And so this is the simplest solution that they could come up with. And so we did a community engaged project in partnership with Catherine and Creech, looking at what does it take to achieve sanitation justice in rural Black communities. And the first phase of the project is a 3-year project, but we just completed our first phase, which is looking at conducting focus groups and engaging with the community that lives there. One thing I did want to say with folks who are doing community engaged research and doing it correctly is not leaving the community once you're done, right? And what has happened in Lowndes County is, for several years now, people have come, collected data, and left, and given the community back nothing, and the community has nothing to show for it. And so there was a lot of reluctance. Really hard to build that trust, but when we were able to, it led to a lot of fruitful discussion and conversation, which I appreciated. And so we were able to do 3 focus groups with a total of 22 participants. The range of sanitation systems, they had 4 homes were doing straight piping, 17 had septic systems either failing or functioning, and then there was 1 person on a centralized system. And then the average of 45 years living in Lowndes County. And that's significant because these are people who have experienced these issues for centuries. They've had families who have passed down these homes to them, and they continue to hold on to that land and be neglected for this long. And so when we were analyzing our focus group data, we really wanted to focus on 4 themes. I just want to am I okay on time? Perfect. Thank you. We were looking at 4 themes. One was behavioral adaptations. How are they changing their behaviors? The next was looking at health impacts and how they perceive the health impacts from these failed systems on their own health. The next one was looking at the physical infrastructure systems itself. And then the last one was the organizational and social systems. And the rest of these slides will be posted. This one says it's full using a washing machine. Instead of we would run the water, but when it's time for the water to run out, I just cut it off, use a bucket to let the water run in the bucket and throw it out the back door. And this was a woman who was talking about manually emptying her washing machine so that it wouldn't drain into the septic and overflow it. The next one was, I was going to say, just like now with the stuff running into my backyard, I don't let my grandkids go in the back. There is some uncertainty linking exposure to septic system waste and health impacts, but we can recognize that there is a lot of exposure and residents recognize that it's a problem. And we haven't measured this, which is why I'm prefacing with that line. But, every time you go out there, it's exposure. You never know what's out there, what you're breathing in, what your skin is in coming contact with, and, especially stuff that's airborne. And that causes a lot of sickness. It might not be what I have. It might not be what you have or somebody else has, but that kind of stuff causes a lot of problems within your body itself and causes a lot of problems. And so recognizing that there is uncertainty in the causes of health problems within these communities, but that some symptoms might be shielding some deeper issues. The infrastructure systems itself. And so these descriptions of different systems help us understand the current condition of wastewater systems. And they talked a little bit about their water and electricity systems. They have centralized water, but they do not have centralized waste. And, I actually had to get a trailer next door to me, had to get torn down because the sewage had backed up so bad into the trailer and it caused mold and stuff. So they They have the raised bed up. These 2 quotes on here are in regards to septic systems that are on mounds, so you can see them, which have been proposed as a solution to improve this percolation issue. But it's inconvenient for residents to have this huge mound just in their yard, in the backyard, and to keep kids away from it. If I see a mound, I'm going to run up to it. And so they have raised the bed up. The tank might be sitting almost level. And they have put their more dirt there just to put it because that's where it percolates. That's all it is nowadays. They don't do them deep anymore. Everyone that they're going to do, they're going to raise them. And then the last one is looking at organizational and social systems, and the complexity of the system, cost of maintenance and upgrades, and some policy barriers really make it harder to get service in these areas. And so the first quote is focused on an installation of a system in multiple steps with payment for both the perk test and the installation. And once it's installed, there's continuous maintenance that becomes expensive. And so it says, yeah, because I had to pay for the perk test and also pay for someone to come out and do the field time and the installation of the septic system, I no longer had any money to maintain it, which I think we left off. They have to be there to make that decision, but the problem is now with their air properties, there's also issue with air property and policy around that in this area. Some of the relatives that have passed on, some of them, it's many issues with the air property. Air properties, you can't make any changes to the property unless everybody on the air agrees. And in some cases, they've had people who have passed away or no longer talk to the family, and so they can't make any changes. And so dealing around, that's an Alabama state policy, and they're hoping to circumvent. We also visited 4 homes to sort of understand contamination and run some tests. We visited 4 homes and tested samples from 3 of the homes. We found, we did some standard water quality tests, some chemical and nutrients tests, and looked at biological contaminants. And there was a lot of presence of fecal waste in the testing sites near homes, as we found. The standard test included temperature, conductivity, total solids, ion and chemical nutrients, chemical oxygen demand, ammonia, nitrate, biological, and fecal viruses. And so what have we learned? What we've learned is that residents have made a large infrastructure and behavioral adaptations, but really are lacking permanent solutions, right? Everything that is happening now, it's a lot of temporary solutions. And the water quality test really revealed that there's fecal waste in their environment near the homes. And so these people are not allowed to really be outside in their yards. There's no garden or planting because everything is sort of a toxic waste site to be outside of your home. And property ownership and lack of access to legal resources. Hoping that this research will sort of cause tides to change some of those things. And so what comes next? We're developing a community survey to capture the breadth of the infrastructure and health outcomes in the communities, health issues in the communities. We are completing more extensive and water soil testing to quantify exposure. We want to look at different seasons. So we went in the summer. We're going to go back in February and the winter to see if those contaminants and particles in the water have changed. And then we want to share our preliminary findings with communities to foster long-term relationships. So not leaving as soon as we've collected their data, and working really hard to continue to build that trust and have them see us as an advocate. And then identifying points of intervention informed by community engaged research to address their sanitation challenges. From an infrastructure perspective, we'd love to design a new and compelling system that's informed by their community. I just wanted to show this framework that we worked on this past weekend at an environmental justice summit, but looking at, policy as a key actor, centering people, making sure that people are the center of what we're working on, making sure that the funding is supporting that, having accountability and enforcement, looking at indicators and metrics. And I think that's, and data and information. I think those middle sectors are really where academia can have a large impact on creating trusted community resources, and then trust, transparency, and equity. And I'll end on this slide, going from anecdotal to empirical. A lot of the quotes that I've showed you today are anecdotal data, people talking about their experiences. And I believe our goal as a collective really in academia and practice is to move communities who are struggling with infrastructure from anecdotal evidence of their experiences and conditions to empirical evidence, capturing these, publishing them, and sharing them widely with our policymakers and the communities themselves. And this requires partnerships and collaborations. I highly recommend co-development and genuine interactions. We are tired, emphasize tired of being analyzed, and we need solutions. And so making sure that we're focused on reporting solutions back to the communities. And then there's definitely a chronic underfunding of water in the U.S. and making sure that we're putting our money where our mouth is. And I think my final point was that funds should be in the form of grants and not loans. Thank you all. I appreciate you giving me the time today. It's a privilege to be here, and I'm more than happy to answer any of your questions.
We have time for a few questions, and Iris and I will pass around the mics if you have a question, so we can get our webinar folks able to hear this.
First off, thank you for coming today. A question about, so you mentioned how there's been like a continual de-investment on the federal level for water infrastructure. And I was just curious why you think that's happened over the past 40 years.
Oh, yes. So a lot of that, initially when the water systems were being put in place, the federal government wanted to invest in a lot in building those systems up with the intention that once they were built up, that the communities themselves would manage them. And so a lot of water systems today are managed at the local level. And so the water bill that you pay every month, that's what's being used to manage your infrastructure at the local level. And honestly, I think then it was a good idea. But I think looking back now, it wasn't the best idea because you have so much local politics that play into who gets access to infrastructure and who doesn't. And how those funds originally were distributed were so inequitable that it honestly just led to more inequities down the line. So, and then now, I don't know, it feels like, and this is a personal opinion, but it feels like water is not a high priority because it's not sexy, right? If I'm allowed to use that word. Water systems are underground. You don't really see them. Oftentimes, when you look at what infrastructure funding is happening, a lot of it is highways because you can see transportation infrastructure. You can see a new train being built in your town. You can see a new bridge going up. You can see potholes being filled. But water necessarily, we all just kind of take it for granted that it comes out of our tap and we shower with it. And the federal government sees that, not too many people are complaining except those with lead in the Northeast. But I think this is where, drawing attention to the issues that we have with water is going to be important in these next several years so that a lot of funds do get allocated this way. Yeah.
Thank you so much once again. I was wondering if you think there's any way that you can ethically prioritize aid to communities with water stress based on the, relative severity of their need. I guess, what might be the best way to prioritize them? What framework would you use?
Working on now. The challenge with water systems, as I mentioned, is that you have to evaluate that at the local level. Every community is going to be composed of so differently. And so what disadvantage means for your community really needs to be evaluated at that level. But in terms of like just an overall framework, I think prioritizing those with the least access, making sure that those who are of low income or when it comes to water affordability, prioritizing those who are low income. When it comes to areas where they don't even have access to piped water, ensuring that we can get them. Now, the way that, when I worked at the city, a lot of what we focused on was safety, and safety was the number one priority. And that meant that, we would fix the pipes that we thought were most likely to fail then and then, versus saying, okay, maybe, the pipes in so-and-so community has been neglected for so long that we should prioritize that. Even though it may not be failing, maybe we should just inspect it. But those conversations weren't happening.
We have time for one more quick question. Is there a question from the audience? If not, we will go to one of our online viewers, perhaps.
Hello. So something that stuck out to me when you were speaking about the privatization of water systems is that with a loss of residential agency, you just kind of pay your bill and you either get access or you don't. So I was wondering what's a good way to move away from privatization that's like not just like, okay, we're done, like figure it out yourselves.
The last part of your question in terms of like what do you mean by figure it out?
Like, because the case study that we just looked at I think it wasn't a case of privatization because each family was figuring out their own water sources. So what's a way to move, or I'm sorry, what's a path away from privatization that isn't just leaving people out to dry and like giving them aid?
When I said that, I was speaking figuratively. I mean, I honestly don't think a state or a city would allow a community to go completely without water, at least not for a long time. We saw in California, they were trucking water. I think Iris also does some research on tribal lands, if I'm not mistaken, and water access on tribal lands, which is also often in the form of trucking in water and not building up centralized infrastructure. But I think this is where funding comes in. I think you have to have funding to support moving away from, I mean, whether it's from privatized to public or from not having access, consistent access, right? Not, having inconsistent access, but having consistent access over time. So, yeah, I would say boosting the TMF, the technical managerial financial capacities of communities, and then also providing the funding to support new infrastructure and the sustainability of that infrastructure. I think one thing we don't want to do is to put systems in place and then not put in sustainable systems, meaning putting something somewhere and then leaving it to the community to figure out without actually providing them the tools that they need to make sure that that system functions the way it's supposed to function over time. Otherwise, you just create a larger problem, right? You put a system in a community, the system shuts down. Now you've created a water quality issue, and they may not know how to fix it.
Sadly, we're out of time. I feel like we could be talking about these issues for hours, but hopefully this begins a conversation for this year's speaker series. And I just want to give another warm thank you to Dr. Osman for his just thoughtful and thought-provoking presentation about water and sewer issues. So let's give him another round. Thank you.